Hello, and congratulations on your new transplant. Thank you for taking the time to watch this educational video. It is designed to help you know what to expect from your new medications after the transplant. Please use the handout provided with this video to follow along and write down any questions. At the end of the video, a pharmacist will be available to answer all of your questions. Let's get started. First, here's what this handout includes. We are going to talk about taking your medications, the transplant medications and supplements you may take, and some tools and resources to help you take medications correctly. First, let's talk about taking your medications. You've probably heard the saying, take your medications as directed. But what does that mean? It means taking it exactly as the directions say or as your healthcare provider says. The consequences can be quite serious when you have a transplant because not taking medications as directed raises the risk that your body will reject the transplanted organ and that you may lose your transplant. That is why taking medications as directed is very important because it lowers the risk that our body will reject the transplant. Not taking medications as directed could include missing a dose, taking the wrong dose, taking it at the wrong time, or taking it for too short or too long a time. It can even mean taking medications that were not prescribed for you or stopping your medication without talking to your doctor first. Here are some common challenges with taking medications, but you can do several things to handle these medication problems. Turn to page 2. First medication challenge is confusion. It is important to understand what medications you are taking, when, and why. Ask any questions you have. Ask your healthcare providers to explain why you need each medication and make a schedule for taking them as directed. They can share tips on how to keep your medications organized and take them at the right time. Second, learn the cost of your medications. Find out what your insurance will pay, what is your responsibility, and how to get help paying for medications if they are too expensive for you. A social worker or a financial coordinator can help with this. Your pharmacist may also be able to help. The third medication problem is running out of medication. Call your pharmacy at least 1 week before you run out of medications for medication refills. Transplant medications are not always common, and some pharmacies might not have them in stock all the time. If you travel, make sure you pack enough medication so you do not run out. We recommend packing at least 7 extra days worth of medication when you travel in case you have a delay or other travel problem. Fourth, call your transplant team if you believe you are experiencing bothersome or serious side effects of your medications. Please do not stop taking your medication unless your doctor or coordinator tells you to. Here is a quick review. Tim Thompson is running low on his medications. When should he call his pharmacy to obtain refills of his medications? A, 1 week before he runs out. B, 1 month before he runs out. Or C, never. His pharmacy has it in stock at all times. The correct answer is A. Tim should call his pharmacy at least 1 week before he runs out of his medications. B is not correct because 1 month is too far in advance to be requesting refills. C is not correct either. You should never assume that your pharmacy has your transplant medications in stock, and you should always call ahead of time to make sure they can get your refills for you. Remember, many transplant medications are not common. Pharmacies tend to have the more common medications on hand, but less common medications may need to be ordered. You may want to mark your calendar to call the pharmacy 1 week before your medication is due to run out. To summarize, taking medications as directed is essential to avoid losing your transplant. Call us if you are confused, have trouble with medication cost, can't get your medications in time, or have any bothersome side effects. Again, do not stop taking your medications before talking with the transplant coordinator or doctor. Next, we will talk about what transplant medications are and about supplements and other medications. This will start on page 3 of your handout. There are 3 types of medications to take after a transplant. These are anti-rejection medications, anti-infection medications, and supplements and other medications. You need these medications for 2 reasons: to keep your transplanted organ healthy and to keep the rest of your body healthy. Let me explain. Have you ever had a cold? I know I have. When you have a cold, there is something in your body that is not usually there: a virus. The virus is making you sick, so your body tries to kill it, and eventually it does. Your cold goes away because your body kills the virus. Your body responds to your new transplant like it does to a virus. It recognizes it as something that is not usually there. Its first response is to attack the new organ until it dies, just like it attacks viruses. Your body doesn't know you need the organ to live. To protect your transplanted organ, we give you anti-rejection medications. Anti-rejection medications lower the response from your immune system, which is the system in your body that fights infections and attacks your new transplant. You will take anti-rejection medications to keep your body from attacking the new organ and to keep the transplanted organ healthy. Taking anti-rejection medications as directed lowers the risk that your body will attack or reject your new organ, but it also increases your risk for infections. That is why you also need anti-infection medications and supplements. They help protect you from getting sick. Most people take 3 anti-rejection medications: mycophenolate, prednisone, and tacrolimus. I like to call these medications the big 3 because these are the 3 medications that work together to keep your new organ healthy. The 3 common anti-infection medications are an antifungal, which prevents fungal infections, an antibiotic, which prevents urinary tract infections and a specific type of pneumonia, and an antiviral medication, which prevents infections caused by viruses. Together, these medications help keep you healthy. We will first talk about your anti-rejection medications. Now, let's look at these medications one by one. The first medication is mycophenolate. You take it twice a day with 12 hours between doses. The most common side effects are nausea, vomiting, and diarrhea. Other possible side effects are on the slide. We recommend that you take mycophenolate with food to help prevent stomach upset. If you feel too sick to take your medications, please tell your transplant coordinator. Also, tell us if you have diarrhea more than 3 times in one day. We need to know because this can make you dehydrated and damage your kidneys. Please know that mycophenolate pills should not be crushed, chewed, or cut. Finally, mycophenolate can harm an unborn baby. If you or your support person are pregnant or planning to become pregnant, do not take or even handle this medication. You need to use an effective form of birth control if you are taking mycophenolate and could get pregnant. Your pharmacist can give you a list of birth control options for after a transplant. If you would like to become pregnant in the future, ask your doctor about taking a different medication. The next anti-rejection medication is prednisone. Some common side effects are increased blood pressure, cholesterol, and blood sugar. You may need to take medications to control these conditions if prednisone causes them. We will decide this near the time you go home from the hospital. You will likely take your prednisone once a day in the morning. It is best to take prednisone in the morning because it can cause difficulty sleeping if you take it later in the day. Prednisone can also affect your mood. For example, some people get angry when taking it. The good news is that we will give you a lower dose over time called a taper. As the dose tapers down, the side effects are milder. Prednisone can also cause stomach upset and heartburn, so you should take it with food. The last anti-rejection medicine I will talk about is tacrolimus. You take this medication twice a day with 12 hours between doses. Common side effects include tremors or shaking and headache. Other possible side effects are on the slide. Tacrolimus can be taken either with or without food, but the key is to take it the same way each time. You also need to avoid grapefruit, mandarin oranges, pomegranates, and the juices made from these fruits. We need to test your blood regularly to check the level of tacrolimus in your body. This is important to make sure the drug is safe and effective. You will need to have your blood tested right before you take your morning dose of tacrolimus. Please do not take your morning tacrolimus until after we take a blood sample. To make things as easy as possible, on days you are getting your blood drawn, please do not take any of your morning medicines right away. We recommend bringing all of your morning medications with you to the lab. Then take them all as soon as we take your blood sample. Bring a snack and water if you plan on taking your medications with food. For our second review, Tim has a lab draw scheduled for today and is trying to remember if he should take all of his medications before or after his blood draw. What should he do? A. Take all of his medications before the blood is drawn. Or B. Take all of his medications after the blood is drawn. The answer is B. Tim should wait to take his medications until after his blood is drawn so that an accurate tacrolimus level can be obtained. There are alternative anti-rejection medications if you cannot take the medications previously mentioned for any reason. The medications, side effects, and special tips are located on page 5 of your handout for your information. Before we move on to the next section, I want to summarize the most important points about your anti-rejection medications. First, you may have to take up to 3 medications to prevent rejection of your new transplant for the rest of your life or for as long as your transplant is functioning in your body. Mycophenolate can be toxic to an unborn baby. If you or your support person are pregnant or planning to become pregnant, please do not handle or ingest these products. Again, tacrolimus is a medication that will require you to get regular blood tests. Do not take your morning dose of tacrolimus until after you have a blood sample taken for testing. We just talked about the medications to protect your transplanted organ. Now, let's discuss medications that protect you. We will first talk about the anti-infection medications. This starts on page 6 of your handout. Since your immune system will be suppressed, this puts you at greater risk of becoming sick. The first medication is fluconazole, brand name diflucan. It helps prevent fungal infections. Some potential side effects include nausea and headache. You usually take fluconazole for 1 to 3 months after a transplant. It is important that you tell your transplant doctor if you are started on any other medications while taking fluconazole, as it can interact with a lot of other medicines. The next medication is trimethoprim sulfamethoxazole, brand name Bactrim. It helps prevent general bacterial infections and a specific type of pneumonia. You usually take this for 3 to 12 months after your transplant. Bactrim can make your skin more sensitive to the sun, so always wear sunscreen. It can also upset your stomach, causing nausea, vomiting, or diarrhea. Taking it with food can help prevent this. If you get a rash while taking Bactrim, tell your transplant team right away. If you cannot take Bactrim due to an allergy or side effects, you may take pentamidine or atovaquone. We will let you know if you need one of these medications. The final anti-infection medicine you will take is intended to prevent infection by a virus. It will either be valganciclovir, brand name Valsite, letermovir, brand name Previmis, or acyclovir, brand name Zovirix. You will take 1 or 2 of these medications for 3 to 6 months after your transplant, but you will not take all of them at once. What you take depends on what viruses you and your donor have been exposed to in the past. The main side effect of these medications is a low white blood cell count. We keep track of this by measuring your white blood cell level in your blood each time you get lab work done. Headache and nausea are other common side effects. To summarize, you will take several different medications to prevent infections during the first year after your transplant. Here is our next review. Tim is on trimethoprim sulfamethoxazole, also known as Bactrim, to prevent bacterial infections and pneumonia. What should he do as a transplant patient, and especially while taking Bactrim? A. Wear sunscreen. B. Take on an empty stomach. Or C. Stop taking it without telling the transplant team because it caused a rash. The correct answer is A. Wear sunscreen. Tim should not take Bactrim on an empty stomach as it can cause an upset stomach. So we recommend taking Bactrim with food. Tim should not stop Bactrim without notifying the transplant team first. We just talked about the medications that protect you from various types of infections. Now, let's talk about supplements and other medications that also keep you healthy. This begins on page 7. These supplements will help prevent complications from transplant medications and promote health. You can get most of them without a prescription. For these medicines, we will put them on your medication list if we want you to take them. We will also give you a small supply of it when you leave the hospital. After that, you can buy them at a store or pharmacy. The first two medications listed are calcium carbonate and vitamin D. These help to keep your bones strong. Some of your transplant medications can weaken your bones over time. Famotidine, brand name Pepcid, omeprazole, brand name Prilosec, and pantoprazole, brand name Protonix, prevent or treat acid reflux, also called heartburn. These medications also reduce the risk of stomach ulcers caused by prednisone, so you should take these medications even if you do not have heartburn symptoms. Aspirin is used to prevent blood clots, as well as reduce the risk of heart attacks and strokes. If we want you to take an aspirin, you will take it just once a day. Additional doses of aspirin should never be taken for pain. We are often asked which non-prescription medications are safe to take for pain when you have a transplant. We recommend acetaminophen, sold under the brand name Tylenol. You can take up to 3,000 milligrams of Tylenol a day. If you have a transplant, you should avoid taking non-prescription anti-inflammatory drugs for pain, such as ibuprofen, brand name Advil, and naproxen, sold under the brand name Aleve. These medications can cause stomach bleeding and harm your kidneys. Lastly, we also recommend that you use sunscreen to lower your risk for sunburns and skin cancer. Your anti-rejection medications and some of your anti-infection medications can make your skin sensitive to the sun, and spending too much time in the sun unprotected increases your risk for skin cancer and early skin aging. You can reduce your risk by using broad spectrum sunscreens with an SPF value of 30 or higher. You should apply sunscreen liberally to all uncovered skin, especially your nose, ears, neck, hands, feet, and lips. Reapply at least every 2 hours and more often if needed. If you do not have much hair, apply sunscreen to the top of your head or wear a hat. It is important to know that this video and handout do not list all the possible side effects or problems with each medication. Only the most common are included. Also, if a side effect is mentioned, this does not mean you will definitely get it. You will not necessarily develop all of the side effects mentioned. If you do think you might be having a serious medication side effect, please call your transplant team. Again, do not stop taking any medications unless the transplant team tells you to. Now, who should know about your medications? It is important to tell all of your healthcare providers that you are on anti-rejection medications. This includes your dentist, doctors and surgeons who are not a part of your transplant team, and your local pharmacists. For all of your doctor's appointments, you should bring in your most up-to-date medication list so everyone knows what medications you are taking. If a healthcare provider who is not a part of your transplant team tries to change any of your transplant medicines, please tell your transplant team right away. There are some medications you should avoid because of your transplant. First, avoid taking medications that are not listed on your medication list. We always want you to take your medications according to your most up-to-date list. If there are medication changes we want you to make when you are at home, we will call you or send you a MyChart message. Please write any changes on your medication list so it is up to date. If you need a new medication list, please ask for one at your next appointment. When we give you a new list, please destroy the old one. Having several different medication lists around can lead to mistakes. Please do not take any herbal or dietary supplements without first consulting with your transplant team. You should never take any medications or herbals intended to boost your immune system. These can raise the risk that your body will reject the transplant. For these supplements, we will put them on your medication list if we want you to take them. Do not take ibuprofen, naproxen, or any other non-prescription oral anti-inflammatory medication. Please see the over-the-counter medications handout in your transplant binder for acceptable medications that you may take. As you know, taking your medications as prescribed is extremely important. Still, we are all human, so if you miss a dose of medication, I want to make sure that you have a plan in place. On your handout, I have listed the halfway rule. If you accidentally miss a dose of your medications, but you are less than halfway to the time you take your next dose, it is safe to take the missed medication as soon as you remember. However, if you miss a dose of your medication and you are more than halfway to your next scheduled dose, skip the missed dose and take your next dose as scheduled. Here's an example. Let's say you are taking a medication at 9 a.m. and 9 p.m. What is the halfway point between those two times? Correct. The halfway point will be 3 p.m. So let's pretend you accidentally forget to take your 9 a.m. medication, but you realize that you forgot at 11 a.m. Since 11 a.m. is before the halfway point, it is safe to take that missed dose. However, if you realize you forgot to take your 9 a.m. medication at 5 p.m., that is after the halfway point. That means you should skip your 9 a.m. dose entirely and take your 9 p.m. medication at its regular time. Now, let's give an example with a once-a-day medication. You normally take this once-a-day medicine at 9 a.m. What is the halfway point between 9 a.m. and 9 a.m. the next day? Correct, 9 p.m. If you miss your 9 a.m. dose, but you remember at 5 p.m., is that before or after the halfway point? That is before the halfway point. So you can take that missed 9 a.m. dose right away. But what if you remember at 11 p.m.? Is that before or after the halfway point? Correct. It is after. So you should skip that missed dose and take it the next day at 9 a.m. as normal. Please never take extra medicine to make up for a missed dose. Lastly, make sure you store your medications in a cool, dry area out of reach of children. Try to avoid keeping your medicines in the bathroom or your car. These places can have large changes in temperature and humidity, which may lower the effectiveness of your medications. Here are some prescription do's and don'ts. We do want you to call your regular pharmacy for medication refills. Keep the name and phone number of your local pharmacy handy. Call the transplant office if you have a problem with your anti-rejection medicine prescriptions. Keep the transplant office up to date on your allergies and any new prescription or over-the-counter medications you are taking. Give the local pharmacist the transplant clinic telephone number for refills, and ask for refills when you are seen in the transplant clinic. Please do not go to the transplant floor for medication refills. Do not run out of medication before getting refills, and do not wait until the weekend or after 4 p.m. on weekdays to call for refills. Now, we will give you some important information in the form of tools and resources. This information helps you know who to call and what to do regarding your transplant medications. This starts on page 11 of your handout. In your handout, we included some key phone numbers to keep on hand. These numbers help you contact some of our OHSU pharmacies and the transplant clinic. Your main medication tools are your medication list and a pill box. Once you are home, it is very likely that over time, the doses of your medications will change. So it is very important that you keep your medication list at home up to date. Keep a copy with you and bring the list to your medical appointments, both here at OHSU and when you see your local doctors. Another important tool is a pill box. We will give you a pill box before you leave the hospital. This tool is absolutely essential for a successful transplant. Pill boxes help you organize your medications and come in a variety of sizes and styles. Some medication boxes are very large and sturdy, but cannot be taken with you easily. Other medication boxes are smaller, so you can take just one day's worth of medications when you are out and about. Most pill boxes are organized by day, from Sunday through Saturday. Some boxes have 4 dosing periods: breakfast, lunch, dinner, and bedtime. I want to spend some time going over how to fill a pill box. Here is an example of a medication list. Yours will look similar to this. The first section of the medication list has the medication name and the strength of the medication, which is how many milligrams each pill will be. The second section are the instructions, which is how we want you to take that medication and why you are taking it after the word indications. You'll notice the next 4 columns: morning, noon, evening, and bedtime. If you see a number in that column, it means we want you to take that many pills at that specific time. Here is a picture of what a weekly pill box looks like. The columns are days of the week. So for example, this pill box starts with Sunday and moves on to Monday, Tuesday, and so forth. The rows are times of days. So the top row is the morning row. The row below that is the afternoon. The row below that is evening. And the last row is bedtime. We'll focus on just filling out one day's worth of your pill box, starting with mycophenolate. As you can see on the list, the instructions are to take 4 capsules in the morning and 4 capsules at bedtime. We will start to fill the morning row with mycophenolate. We will continue to fill the morning row until there are 4 capsules in each of the morning compartments. Once the morning row is complete, we will start to fill the bedtime row. We will fill the bedtime row until each of the bedtime compartments contains 4 capsules. Once there are 4 capsules in the morning and 4 capsules in the bedtime row for each day, mycophenolate has successfully been filled in your pill box. The next medication is prednisone. The instructions are to take 2 tablets in the morning. We will fill the morning row with prednisone until there are 2 tablets in the morning row for each day. Once the 2 tablets are filled in the morning row, prednisone is now filled in your pill box. Moving on to tacrolimus. The instructions are to take 6 capsules in the morning and 6 capsules at bedtime. We will start to fill the morning row with tacrolimus. We will continue to fill the morning row until there are 6 capsules in that compartment for each day. Once the morning row is complete, we will start to fill the bedtime row, placing 6 capsules in each bedtime compartment. Once there are 6 capsules in the morning and 6 capsules in the bedtime row for each day of the week, tacrolimus has successfully been filled in your pill box. You will do the same process for every day of the week. When filling your pill box, you would continue this method until you've made it through every medication on your list at its scheduled time. It's a good idea to sit down at the same time every week to fill the pill box for the week ahead. Medications marked to be taken as needed do not need to be placed in your pill box. If you have any questions about filling your pill box, please ask your pharmacist or transplant coordinator. The first place to turn if you need help with medications is your transplant coordinator and pharmacist. If you have questions about any of your medications, you can contact the transplant coordinator. They will then contact the transplant pharmacist to answer your questions as necessary. The transplant coordinators and pharmacists are available Monday through Friday. The next bullet point is prescription refills. If you want to refill your prescriptions at your local pharmacy, please have them call the OHSU Physicians Pavilion Pharmacy to transfer the refills on your prescriptions. You can do this as soon as you get home from the hospital. If you need a medication refilled, please contact your pharmacy first. You should do this when you have about 7 days left of your prescription. If you need a new prescription, this gives the pharmacy time to contact your transplant doctor. However, if you are down to your last day or 2 of medicines or run out of your medications, call your transplant coordinator as soon as possible. The last bullet point is OHSU's Creekside Mail Order Pharmacy. If you are interested in participating in OHSU's prescription mail order program, you can call their phone number as shown in your handout. Please know that the OHSU Creekside Mail Order Pharmacy does not have automatic refills, so a phone call to the pharmacy will be required for refills. For our last review question, Tim noticed that he is almost out of tacrolimus, one of his anti-rejection medicines. He has about 7 days left until he runs out of tacrolimus. Who should he contact first to obtain refills? His A. transplant floor at OHSU, B, his local pharmacy, or C, his transplant coordinator? B is correct. Tim should contact his local pharmacy first. A is not correct, as the transplant floor at OHSU will not be able to help you obtain refills. C is not correct either. For standard refills, you should not be contacting your transplant coordinator first. Please only contact your transplant coordinator if you have 1 to 2 days left of your prescription, are out of your transplant medications, or are unable to get refills for whatever reason. This concludes the transplant medication video. I would like to thank you for watching. I hope you found it very helpful. A member of the pharmacy team will be happy to answer any questions you may have. And on behalf of the transplant pharmacy team at OHSU, have a wonderful day.